Hepatitis A is a viral infection that primarily affects the liver. It is caused by the hepatitis A virus, HAV, and is generally considered less severe than hepatitis B or C. Hepatitis A is typically spread through contaminated food and water or close contact with an infected person. Here's a comprehensive awareness of the illness. Transmission. Hepatitis A is commonly transmitted through contaminated food and water, consuming food or water contaminated with the virus, especially in areas with poor sanitation or hygiene practices. Close contact, coming into direct contact with an infected person's feces, which can occur through practices like changing diapers, sexual activity, or poor hand hygiene. Symptoms. Symptoms of hepatitis A can vary widely, ranging from mild to severe. Not everyone infected will show symptoms, but they can include fatigue, fever, loss of appetite, nausea and vomiting, abdominal pain, dark urine, jaundice, yellowing of the skin and eyes, pale-colored stool. Duration. Hepatitis A symptoms typically appear 2 to 6 weeks after exposure to the virus. The illness can last a few weeks to several months, but most people recover fully without long-term liver damage. Severity. Hepatitis A is generally not as severe as hepatitis B or C, especially in terms of long-term complications. However, in some cases, particularly in older adults or those with underlying liver disease, it can lead to acute liver failure, which can be life-threatening. Diagnosis. Hepatitis A is diagnosed through blood tests that detect antibodies specific to the virus. These tests can determine whether a person has been infected or has developed immunity through vaccination. Treatment. There is no specific antiviral treatment for hepatitis A. The body's immune system usually clears the virus on its own. Treatment mainly focuses on managing symptoms and supporting the liver's recovery. Rest, proper nutrition, and avoiding alcohol are recommended during the recovery period. Prevention. The best way to prevent hepatitis A is through vaccination and practicing good hygiene. Vaccination. Hepatitis A vaccines are available and recommended, especially for travelers to regions with higher rates of the disease and for individuals at higher risk of exposure. Hand hygiene. Regularly washing hands with soap and water can greatly reduce the risk of spreading or contracting the virus. Safe food and water. Consuming clean and well-cooked food, drinking bottled water, and avoiding potentially contaminated sources can prevent infection. Safe sexual practices. Practicing safe sex can reduce the risk of sexual transmission. Global impact. Hepatitis A is endemic in many parts of the world, particularly in regions with inadequate sanitation and hygiene. Improved sanitation, vaccination efforts, and public health awareness campaigns have helped reduce the incidence of hepatitis A in many developed countries. Conclusion. Hepatitis A is a viral infection that primarily affects the liver. It is typically spread through contaminated food and water or close contact with infected individuals. While most cases of hepatitis A resolve on their own, vaccination and practicing good hygiene are important steps in preventing the spread of the virus and reducing the global impact of the disease.